please welcome Martin Sedivy. So, right. Oh, wonderful. Good evening. I think most of you have had a very long and strenuous day, and your capacity to take up further information is nearly gone, so you need a little bit more attention. We try to put things into practice as soon as possible, and this is why you see this, sort of bed in front of me. It's about performance. It's about our ability to, perform well. Often we have got certain exercises and training units, and we do not make any progress with our customers, or there's stagnation, or even after intense sessions, our customers complain about some problems in their knee joint, in their ankles. Often we try to do everything via the anatomical and the biomechanic way, so all the nutrition or fascia training has been included, but nonetheless there might be some imbalances within the system which result in the fact that we do not optimally harness our potential. I think each and every one of you saw the following movement when the customer puts down his leg to make a lunge. Well, it's in an unstable position. You perceive quickly, and you can avoid it very nicely so that the trainer cannot see it when I go down immediately and come up again. So to me, as a trainer, it's relatively difficult to perceive this instability and to find out whether there's an optimum flow of performance. When I see a customer, and then when they put their foot down in a lunge and show this instability, it's really a problem of the muscles. The muscles do exist, and when they move on their own two legs into the fitness studio, I know that they should be strong enough to do so. So I personally find then, so what is the cause? What is the root cause? Why can't I make any progress during the training session? Why is my customer not gaining more stability even when I engage in stability training? So I have to ask questions to my customer's body, because weakness in the body always has to have a cause, and I rarely find it where the actual weakness shows and manifests itself. Many of our customers are suffering from knee issues, and in terms of knees, we've got plenty of surgery being performed, and often these surgeries don't make any sense because they operate a healthy knee. So the problem of pain in the knee is rarely due to the knee as a root cause, but there are some sort of deficiencies in the system, so that the knee is at the suffering end, so to speak, so that the force flow is not guaranteed. I take a look at that during my when my customers there will brief neuromuscular screening tests. We show the body this is the root cause for your weakness and shortcoming. Once the body is aware of the cause of the weakness, the body will take care of it itself. I give one example. Well, when I cut myself, there is no need to tell my body to send the thrombocytes out to close the wound. When I've got a bacterial infection or viral infection, there's no need for me to tell my body what to do. The leukocytes move out there. But what do we do when there is, pain in the joints or, in other parts of the bodies? We try to avoid the movement, not to feel the pain, or we take some ibuprofen or other medication and painkillers because we want to have to function. And often this is a problem that the body as such doesn't perceive what the real reason for this impaired performance is. And here it's about rebalancing the overall system. Well, I had a volunteer from the EMS area. Well, there was a draw that took place, so I got a volunteer, so to speak, who's going to support me. He will confirm to you that I don't know anything about him. No prior knowledge. Hi. Right. Felix, before we even start and you lie down on this sort of stretcher, I would like to ask you to simply stand up straight upright posture so that we can see, well, he's able to stand on his two legs. So we've got active musculature. And the second thing I would like to see from you is just move up front in a lunge, but, well, stay like this before you move down. What did you see? What did you perceive when he did it? Oh, yeah, well, this was wobbling. Well, it wasn't only in the pelvic region, but also an effect on the knee. You could see that the muscles he has, well, is insufficient in terms of the flow to secure the knee properly. Well, do it again. Well, it will repeat itself. Well, wonderful. And again. Well, it's a little bit better. So we could do it until at one particular time we get a status which is okay, but I am not up there 100% of my performance as it should be. So now when I plan to do box jumps or high-intensity squat training with my customer or lunge sidestep variations, and I know that there is a high impact on the whole lower segment of the body, and I knew that right there in the pelvic region or in general in the, lower part of the body is unstable, I wouldn't be able to start training with him, not without, stretching the system. I will take a closer look at why this is the case in the other side too. Well, this is only, is it a one-sided problem or a two-sided problem? Yeah. There's on this side, it looks better, isn't it? And when you take a very close look, he's not 100% stable. He's trying to do a lot with the core system, take it out of the dorsal of the trunk system, and which is not landing in the lower part of the body at the moment. He, puts his foot down. He has to be stable. So now I will start in a moment to ask his body questions. And we take a look at his lunges later on, so maybe I prepared you for training properly. So just take your shoes off, please. Well, just lie down. Well, supine position. Well, and then the tests I'm going to perform. It's not possible in each and every studio, but I can also do it without a stretcher. And tomorrow I'm going to do it, well, by testing movements and motions as such. You feel well. You feel ready to go and relaxed. Fine. So what I will briefly do is I simply wake up his nervous system. And, we warm up our muscles, but our nervous path, they remain in a coma. So these are the, things we have to wake up are the, frontal, the transverse, and the longitudinal paths woken up. So this is only to prepare him better for all the tests I'm going to perform. So what I need in order to test his functional systems is an isolated strength value. And this isolated strength value is something I take out of the pelvic flexor group. Even if one of the flexors is not activated properly, the sum total gives me a strength level which I can use as a reference value, provided that the customer was possible to walk to the fitness studio on his own two legs. And if that is, I know there has to be sufficient strength. Just let go, let loose. And I will move your leg down actively, and you try from the, pelvic regions, from the hip to build strength in my hand. Well, my hand puts pressure, downward pressure. You have upward pressure. Try to loosen your shoulders. Try to keep other muscles out to help you in this. So my command will be ready and hold. And then while you hold, you try to put up strength. So get ready and then hold. Okay. Then I see, how much force his isolated muscle can build up in the first place. The power flow was there immediately. It's not about having the actual maximum of possible flow of power, strength. Each and every day you've got your daily form and shape, depending on many factors. But I simply need a value, a reference value, based on which I can test all the functions of the body. And here, one more time, get ready to go and hold. Okay, here we go. So both show good values. I can work as reference value. Wonderful. So what I've seen, first of all, is when he put his foot down, there was an instability. So I really take a close look at the lower segment chain of the body. Is it a problem that originates right here? So he's in the zero position when lying on the stretcher, which means in the zero position he's strong. What I would like to see that when there are shear forces impacting on the pelvis, like when I make a step forward, there are shear forces impacting on the pelvis, which must not result in a loss of performance. When I'm stronger standing than when I'm running away, then the Homo sapiens wouldn't have survived the animals chasing them. So it's important for me not to lose any of my performance and strength due to the impact of some forces. So by changing the angular position of the legs, I try to provoke the shear forces. So these are the shear forces of a lunge position or of a swift walking. And, well, I still want to know whether there's just as much strength. My movement, yours, just let go and ready and hold. Okay, yeah. Well, not quite as strong as before. So much we would have get ready and hold. Okay, super strong. Indeed. So as soon as I move to the angular position, get ready and hold. Okay, there he is losing in terms of strength. As soon as I can move clearly, I do not have to press down until it's down. I know before that he doesn't, well, have the ability to hold the strength as with the reference value. So when I change this angle, I've got a reduction in strength flow. The other side now, this on its own cannot be responsible because this side wasn't so bad to make him completely unstable. Your movement, my movement. Just get ready and hold. And, well, then keep your jaw loose. You are working with the trunk. Allowing a weakness is always such a matter. We are always in this competitive mode. All systems are strong. I'm not weak. No weakness whatsoever. So the reference as such, get ready and hold. Well, there he's super strong indeed. Well, I could do my pull-ups on that one and get ready and hold. Yeah, no, not on this one. Because now when the other muscles he activated to support him are switched off, then I can perceive this difference very clearly and distinctly. The goal is not that other muscle groups should take over this task. And now I know I'm fully cognizant of the fact that somewhere in the lower segment change there is a weakness, but I still don't know what exactly. And now I ask more specific questions, and I will see whether everything, well, in the iliosacral joint is okay. There is then ilium, I put some pressure on, and, well, I have then ilium, which shouldn't weaken. It's a lot, weaker than before. Reference and hold. Super strong. Pressure. Get ready and hold. Where there the strength is not built up, as soon as I've got the pressure on the ISG, he loses force. This cannot be our target, but right here, let's take a look at other positions. Right here, well, put your fingers on, the pubic symphysis. Well, there's no need to move your hands inside the trousers. You can keep them outside. Just try to touch the area from the top. Nothing else, no other tissue. And now I ask his system whether maybe the pubic symphysis is not in an optimum position compared to the cartilage, whether it's shifted maybe. There's a clear weakness. Clearly. Well, the reference as such and hold. And right here, ensure that the system perceives it. It's not important that I perceive it, but that the system recognizes it so that it can take care of the situation. Well, just hold. Okay, do you see that he tried to build up strength with the hand? Well, allow weakness once it's there. Well, all you athletes, all the same. Quite obvious. Now let your jaw bones go and the hand go, and then we take another look at it. Just get ready and hold, and down we go. There is not a lot. There is no need to put pressure on it with the other hand. So with him, what seems to be the case, what exactly we would have to find out is the pubic symphysis doesn't have the degree of hardness or softness it needs. Maybe too open, too wide. The strength doesn't go into the direction it should go. Maybe shifted. Maybe an impact load was exerted or whatever. Maybe you land wrongly. There might be some sort of shift in the pubic bone area, on the pubic symphysis area. Well, then tension is primarily controlled by hormones. So our body has got the ability to put, cartilage in the soft or hard position. Every woman who had a child, organizes itself. Nobody, delivers a child with a hard and solid pubic symphysis. Then man would die out. So I know pubic symphysis there. I do have a problem, and I do know that in the sacroiliac joint region, the IS joint region, I've got a problem. I will perform further tests, one that is enormously important for forward movement. In each step, I've got a contralateral movement, left leg, right arm, or vice versa. So I've got the contra loop of the body. I take a look at that reference and hold super strong. And now I only take the arm in addition to that and see whether I still have the same flow of performance, my movement, your movements, okay? You focus on the shoulder, on your hip, and loosen up, and the rest is loose. Well, and then, as soon as the arm is added, he loses. Well, get ready and hold. Well, super strong. Well, with arm, get ready and hold. Well, it's not super strong anymore. It's not a dramatic thing. I could recommend him to go out, walk there, but don't move your arms. Doesn't make sense, looks stupid. But what we're trying to do is we try to establish, is it a one-sided problem or a two-sided problem? So I have to take a look at the other contra loop there. Your movement, mine. Well, get ready and hold. And, even if he wants to, he's not that strong. Reference value, super strong, plus arm, and hold. No. So it's not a dramatic thing, I found, but he's got a clear loss in terms of performance. So what the problem is, we've got a two-sided weakness. One of the contra loops shows a weakness, the second one too. There's no need to take a look at the loop itself, but I have to look where the order, the instruction is given. And this is up right here. This is where it starts. So what I do is I ask his system some questions as to whether from the system from the skull is responsible for not transferring the instruction properly. Just open your mouth for that purpose. Often, you wouldn't believe it, it's the jaw. Jaw, which is responsible for a lot of loss in terms of performance. Please, use this, hand and touch your left jawbone. You are in this little dent. I ask whether the left jaw is responsible for his weakness. If this is the case, and the system will find out, it will immediately find a way for strength flow. If the left jaw doesn't have anything to do with it, will just remain as weak as before. His body can only give me a yes or a no, strong or weak, and nothing else. Get ready and go. Hold. Well, super strong. Then remove your hand, and then get ready and hold. Well, no. Well, the hand, use your hand. So his system has to learn that his left jaw was responsible for the weakness. And once his system establishes that, the flow of strength will start. Get ready and hold. Okay? Super strong. One more time. The cause can only be located on one side. There is not a two-sided, a dual-side reason, unless I have got a broken jaw on two sides. So after we found the reason for that, nothing should happen, because otherwise I would have done something wrong. Get ready and do, well, no, that's weak. Come on. Get ready. Well, let it go, loose. Get ready and hold. Super strong. So you can perceive the difference. I know on the left-hand side, we have the problem. It may be that the pain is on the right-hand side, but the reason is his left jawbone. What do? I'm not a dentist. I am not, surgeon there. The important thing is that his system knows that the jaw muscles are imbalanced, and, well, the jaw is the strongest muscle by far. So once I've got an imbalance, I've got an enormous impact on energy flows in the body. Well, whenever you've got problems with your teeth, you know how much in terms of strength and performance you lose. So how do I make my customer fit? I've got the results. I have got the pubic symphysis. I've got the IS joint. I've got this left jawbone, and now the positions. Well, what you have now is a clearance procedure. While he's in a prone position, I make sure that the systems are prepared and optimized, and I ensure later on that the flow of strength will remain. I look through the bones, and there are some cracks here, the tarsal bones I go through, and I hear the sounds. In the ankle, I fix it. I have got a slight pre-tension until I see the pelvic movement, and I set small minimum impulses and stimulations, and they then move up to TH6 up there. So this is nothing that needs force. I can do it with my little fingers, and I am not resetting bone, so to speak, and whether it doesn't matter what kind of person, very strong or very thin, I have in front of me. What will be interesting is the result. Have I interpreted his system very well? Will he be strong? And I can start high impact training. If I misinterpreted his body's signs, I have to continue looking around, and I lost a customer because they don't trust me anymore. Well, back in the minimum impulse given. Well, since we found a tiny little cause before due to the IS joint, I could have performed deeper going IS joint testing. We don't have the time to do so here. Then I see whether there are some, tensions and the ligaments. I'm very, very soft and gentle here. Try to find out whether there are some lines of impact. His body is blocking. His body doesn't want to perform. Well, his pelvis is okay. Well, I've seen different pelvic areas. It's fascinating when you do it with women just after them giving birth. Sometimes the whole thing is wrong. Well, now we've got the system we were able to slightly influence it. And now, by using my hands, I only want to put the focus on the SI joint, on the sacroiliac joint. Via hormonal activation, the pelvic ligaments and the overall systems are activated in a balance and an equilibrium so that the tensions can actually offset each other. Well, I've got another 5 minutes, okay? I do not want them to switch off power. And I stand here on my own. Yes, of course I do so. Then, well, we shorten the process just a tiny little bit. Now I see whether the, spinal column is transferring pulse by pulse. We've got 24 perfect segments that move, and when I tackle one dorsal process, the transfer has to happen. And when, it stops somewhere, there is a block somewhere. It's minimum touch. I can only use my fingers, and I simply make sure whether his pelvis responds, whether the pulse is transferred down, also cervical column, but it's not something that's there, but it looks good indeed. Thoracic spine, a little column, a little bit better, but no interruption. And now I move over to the fascia tissue, start with thoracolumbaris, and I see, do I get a recoil effect? It's fine, wonderful, wonderful. All of that is okay. Then in the thoracic spine, I see where his system comes in. Well, just a moment. We nearly got it. No pictures, please. Well, you are a nice audience indeed. At least there's somebody who's laughing in the first row. Well, you have got a better time in the booth than up here, yeah. Oh, well, relax. And, wonderful. I love this. Okay, also looks pretty good. Then, again, supine position. Back on your back. Well, move forward, move down a little bit. Okay, great. So I cannot stop right in the middle. I have to finish off in the region up there. You shouldn't press your head down, but you relax fully. Yes, here we go. Well, just imagine your head is right somewhere in the water and floating, and my fingers are between the brain and the atlas. It's often there, an area that is often released, and there relatively frequently we have got something which is wrong. The natural gap between the skull and atlas often doesn't exist, and so the flow is no longer optimal. We didn't do the testing, but nonetheless, in my clearance process, I have to include it. Just let loose. It's fascinating how people believe to relax without being relaxed. Just relax. Great. Okay, fine. Well, good. Well, here, gentle movements. So with you, we found it's the jaw, left-hand side. Well, at the end, another focus on the left jawbone. Now you can close your mouth again. Well, there the jawbone works. Once you can yawn like that, no problem whatsoever. Well, the color is changing. Well, nearly as red as the dress you're wearing. And this has to suffice because, well, out of this 1 hour PT, I would like to, well, give my customer the remaining 40 minutes into high-intensity training. So see about the outcome. We had a few tests that went wrong before. We didn't have optimum strength, and now my movement, your movement. Focus, concentrate, get ready, and hold. Okay, super strong. Well, you saw the difference from before? Yeah, well, he's grinning. Yeah. So, and then, well, will it lose? Well, don't spend all your energy beforehand. My movement, your movement. Concentrate, get ready, hold. Super. Okay, great. Very, very strong indeed. We had this jawbone problem where I recommended that you... move gently. So, okay, get ready and hold. Super strong. Well, my move direction, yours, going down. Get ready and hold. Well, super strong. Okay, so now his system is prepared. So what is relevant to me in training? I wanted to train the lower segments of the body. The flow of strength is there. It does exist. And now he will probably have his best performance in box jumps or squats or whatever. Don't jump down. I do want the pubic symphysis to, well, dislocate again. So during the first repetition, he will feel unstable because his system is rebalancing, so to speak. So please, well, did you do it with the shoes? Then put your shoes on to give us a proper comparison. And now, well, what do you expect? Do you remember on the right-hand side you had the, well, more pronounced problems? There it wasn't really like this bat wings, but it was, the knee. We start with the right leg. I'm highly interested in that one. Well, okay. Well, and back. And one more time. Okay, back. And again. Aha. Did you see it? You really saw it with your own two eyes before. Do you find a difference? Well, he is a lot more stable now. So when he's working with the same strength he normally applies, then his system doesn't get that load anymore. And now in muscular terms, we have got a high performance, and this reduces the load and strain on my passive systems. And this is my target. I do not only want to look good with 30 or 40. No, my objective was, well, when at the age of 75 I'm still on my snowboard and youngsters cannot show me what's what, I've done everything right. And this is what we want to get. Thank you very much. Thank you. So should you question? Just stop. No. And there we go. Well, you got the message. So I would like to thank you very much for your interest. And should you have questions, we are, of course, available to you. I'll be there in the VIP corner for a few more minutes. And if not, well, you find it at the K.O.R.E stand in Hall 8, where you can try and test it. And I would also like to thank the Glucker colleagues so that, like last year, we could present the core performance. Thank you very much. All the best to you, and enjoy your stay here. See you soon.